My name is Leon. I am a pharmacist with Legacy Pharmacy. What I really like about Legacy is that in the pharmacy, we have so much more, there are a lot more diverse roles, but at the same time, as a pharmacist, if I'm working on certain roles, I can focus on those tasks. Back in my previous retail experience, you're often pulled for working on insurance, checking out the front if you need help. At the same time, you're also filling prescription and verifying and answering phone calls and answering all other slews of questions all at the same time. Whereas at Legacy Pharmacy, we have a big support team where the roles are a little more specialized depending on your duties of the day. That makes the workflow a lot more manageable, even if things are still, there are plenty of tasks to be completed, but it is more manageable and it's easier to deal with. For patient care experience, I think what I really love, and this is not something also I didn't see in other settings, and it's the sex positiveness. Because in Legacy Pharmacy, it's not the only part, but HIV care is such a big deal in what we deal with. It's both an issue for the LGBTQ community and also everyone else. It's a whole United States issue. And one thing to engage in that conversation is that people gotta be able to talk about sex. And as an openly gay man, it's not always easy, but when I was doing the prep appointments with patients, in which we one-on-one engage as a pharmacist with patients, we go through the sexual history, we go through whatever the current conditions are, and to initiate or maintain people on their PrEP medicine, which is a HIV prevention regimen. People have opened up to me so much, and I loved it that I was able to engage in a happy conversation about sex. We talked about your preferred position is this, you were having a good time doing this and this. Sex is part of health and awareness. We should be able to talk about it openly without shame. Because the moment that we are not able to talk about it, me as a healthcare provider, I wouldn't be able to give you the kind of assessments that I need or provide the right medicine or give you the right referral. So the fact that the patients here had felt so comfortable with me, for me just being here, that was something phenomenal to me. So one thing I'm super impressed by working here was the different levels and dimensions of care we're able to provide to the patients. One of my biggest frustrations back at my previous retail company was we wanted to help, but a lot of times, if the medication were to be rejected by the insurance, we could send a notification, but that's where it stopped. If the medication is out of refill, that's where it stopped. It's not that we didn't want to do more, we didn't have the resources or the infrastructure or the layout set out to actually have a quick access to it. And that is something completely different here at Legacy. I think these barriers of care, we have a dedicated financial service team. When patients cannot afford medications, when patients have rejections with insurance issues, the whole team is dedicated to help solve those problems. If patient can afford, we help them look for different funds to pay for the medicines. If there's a rejection, we have a team dedicated their time just to be the bridge between the provider and the insurance to solve that problem. When there's issues such as medication adherence, such as waiting for the refill, we have another team, the medication adherence team, that directly helps us to solve those problems. So it was almost unheard of before to have these kind of issues solved within a day or two sometimes. Back at other retail companies, it's very often that some of these prior authorization issues could last for a week, 2 weeks. Nobody bothered to follow up, and patients just fell through the gap. Here, we definitely have the dedicated resources to make it happen. So as a pharmacist, I felt more empowered that I can actually do more for the patients. And I think as patients also felt more comfortable because you're actually taken care of by things that we can do more than others could. One of the questions that we have is, how would I summarize how I feel about Legacy service? And the first thing that comes to mind was a quote from Lilo and Stitch. It was, Ohana means family, and family means nobody gets left behind or forgotten, because all our patients will be taken care of one way or another.